Aloha mai kako. Dr. Elliot Joseph Kaloava is the Chief Medical Officer at Waikiki Health. It's a nonprofit community clinic that provides medical and social services even when a person has no means to pay. Dr. Kaloava is the recipient of numerous awards for his work with HIV/AIDS patients and is widely recognized as one of the most respected HIV physicians in Hawaii. Dr. Kaloava is well known for his compassion and caring for patients. The circumstances of his childhood could have shaped his character much differently.
In the beginning, it was just my mom and I, because when my mom got pregnant, she didn't want to marry my dad. So she basically ended that relationship, and then she was on her own. And so we lived in Hotel Street area, different kind of small, room she could rent. I always felt real protected because my mom was very tough herself, emotionally, physically, so I had no problem. And especially going down to Hotel Street, my mom was like, one of the bulls back then. And so a lot of people were afraid of her, so nothing happened.
Does that mean she fought?
She did. Physically, she fought. In fact, she likes to tell people a story. She tells them that, somebody she meets, some of my friends, and she'll tell them, "You think my son's a good boy?" And they'll go tell, "Yeah." And they say, "No, he was in jail." And then they'll look and say, "What do you mean he was in jail?" Because when she was pregnant with me, she was in jail. And then she was in jail again when I was about 5. And then I stayed with my godmother, so I would go and visit her for a few months that she was in jail. But that's how she was. In fact, she even had stabbed a sailor once. She used to carry this knife with her, and I remember seeing it later. And he basically got fresh with her. She pulled it out and stabbed him. And her nickname was Unknown on Hotel Street. And the reason was whenever there was a fight, the police would come and they would ask who was involved in that fight. And because people didn't want to squeal on her, they would say unknown. In a sense, we don't know. And that's how her nickname became.
That's what it shows up on police reports. Oh. Did you have a sense of fear?
No, and see, this is the thing. When I talk to others, especially people who maybe come from broken homes, and people ask me, what was it? And for me, I always felt loved. Because even though my mom lived that lifestyle, I always felt loved by her. I never felt like she was neglecting me. I felt like that was just normal to grow up there. And then because of my other family, my godmother, my aunts, my uncles, they all showed me love. And so I always felt like I was loved. And that's why I never felt like I had to join a gang to get love there. You know how some of the young ones go through, or to belong. I always had, I felt real loved. And that to me was the key.
Did you feel like your life was normal?
Yep, I did. And I felt it was normal to go to Hotel Street. I remember one time I was about 10, I think, and she had this car. It was a Standard. And we left the bar about 3 in the morning, and the car couldn't start. So we had to jump start it. And so it was just her and I. So she's behind the wheel, the middle of Hotel Street. And that was when Hotel Street was 2 ways and, no traffic. So I got out to push the car. So I'm pushing the car at about 2, 3 in the morning. And there was a young man about maybe in his, 20s. And he saw, so he yelled. And my mom was drunk behind the wheel. And he yelled, "Woman, do you need help?" And she thought he was getting fresh. So she swore at him. And so he just kept on walking. And I thought to myself, I need the help. Why'd you do that? But finally we were able to start the car. So, but again, that to me wasn't anything unusual.
Did your entire childhood go this way?
The thing was, when I was growing up, part of me felt like I didn't know where I really belonged, because I was growing up in the housing, and all my friends in the housing were people that, when we go to school at Palolo Elementary, they were in the special education class.
And when did you go to Palolo Housing? How old were you?
I was about 6.
6?
From first grade.
What was that like? Did you feel comfortable there?
I did. I felt completely at home, And there, we all knew each other and everything,
Okay, and then did your mom's lifestyle stabilize?
No, continued the same.
What was your routine like at home in Palolo Housing?
The way it was Monday through Friday, I'd get up to go to school. My mom would be sleeping. I'd make my breakfast. Then I would get ready. I'd kiss her, on her cheek while she's sleeping, go to school. Then when I would get home from school, she would be gone already, because then she would leave to go to the bar. And then sometime early evening, she'd call me, and just to let me know that either my dinner would be on the kitchen table that she had made, or she would tell some of the people in the housing, some of the other families, to bring dinner over for me. And then I go to bed whenever I wanted. So usually I go to bed about 10. I did have this one fear, though, living alone, is I used to love watching horror movies. And it wasn't too smart to watch it when you're home alone, especially then. And so I used to watch, and I didn't want to hear these different sounds. So when I go to bed, I would be in my room, my overhead light would be on, and my radio would be playing. So it got to the point where I could fall asleep with lights and noise. So I never needed a quiet, dark room. But that was because I wanted the radio to block out hearing any kind of ghost walking outside my window. And then, you know, I'd wake up the next morning and she'd be home, but she'd be sleeping again. And so it was only on the weekends when we would talk face to face.
So how did you handle that as an older kid? I mean, because you can get into a lot of trouble when you're a little older, especially.
Yeah, and I'm not sure why, you know, because I used to hang around with these kids in the housing, and you know they were all getting into trouble. And now some of them have been in jail. One, I heard, you know, he was murdered, you know, maybe in his late 20s. So they all kind of went, and so I used to hang around with them. But the interesting thing, then when I go to school, because I would be in, you know, what they call the A class then with the smart kids. So I'd hang around with those kids, and they were outside the housing. So they had a lifestyle that was more like middle class, middle class, you know, income class. And so in the housing, I'd be one group, in school, I'd be with another group. And it's funny because when we go to school, the kids I was with in housing, we'd walk to school, then I dropped them off at the special education class. I'd walk to my class. After school, I'd walk back, and I'd pick them up, and we all go back into the housing. So, you know, so that's kind of how things went. So, yeah, I look back, and I think I could have gotten into trouble with them. But I think the main thing, I give my mom a lot of credit. My mom was very strict, even though she was doing that type of lifestyle. Her feeling was she never wanted me to have the kind of lifestyle she had. So she would always tell me that, because she only went to 8th grade, to Kalakaua Intermediate, and then she quit school. And so she would tell me, you study. And even though she wasn't home when I'd come home from school, I guess because I knew she could be so firm, you know, and because I knew she really wanted me to do that. When I came home, I would study. I got all my homework done. Then I would go out and play with the housing kids. So the housing kids would just wait until my studies were done, because they didn't have to study. So I would study, and then I go. But I think it's because she drilled that in me. She says, education is what you need. And so she would force me to make sure I did that. But her influence was so strong, even though she wasn't physically there. I sort of always felt the need to obey, even though she wasn't around. But I loved to read. I enjoyed studying.
So you felt very wanted.
I felt very wanted, and I think that's what made me not have a desire to feel like I had to get into, you know, trouble or do it. Because I felt that's the key. I felt very loved.
That's very different. I mean, you know, it was neglect.
I know. I look back now, it was neglect. And I look back and I think, why do I get the sense that my mom really loved me? Well, for some reason, I think it's because when I interacted with her, you know, I could see the love. And because she was very strict, and you know, back then, you know, parents were disciplining kids with what would be child abuse. Because, you know, I was hit with the clothes hanger, the iron ones, with the belt. And one day she had shared something with an adult person who happened to mention it to me, is that when she would do that to me, and then I go to bed crying, that after I fell asleep, she would come into the room and basically cry because she had done that to me.
What had you done to cause her to whack you?
When I would try to get into trouble, steal or things, and if she found out about it, because she always told me, don't do anything bad. So she would always tell me that. Even though she did, she said, do not do anything bad.
It's
funny. It's a double standard.
I know, it's such a contradiction in terms.
It is. It really is, you know. And I think it's because she so much didn't want me to be like her lifestyle. Because the bottom line is, when she got older, she shared with me, she was not happy with her lifestyle at all. So it wasn't like she was happy living like that.
I want to know what your mom would have said if you said, hey, Mom, if you really don't want me to turn out wrong, stop doing what you're doing and be here with me, and don't show me that example. She
would have just ignored it. She would have said, I don't care. You're going to do it. That's what she would have said. That's the kind of person she, you know, she's the kind of person really didn't care what others thought. This is what she told me, and she would tell me this several times. She said, don't care what people think if they're not feeding you. And so that's why I grew up having that kind of a, you know, that tough thing where it's hard to offend me because I have a tough skin. And I tell people, you know, just tell me what you think, because I like it to be constructive. And to me, in order for it to be constructive, the person has to tell you what they feel. And likewise, I tell them what I feel. But that's from my mom. It's all just to make things better. So it's never with malicious. It's always to make things better.
But when you dish it out, you have to be able to take it.
Yeah.
Can you take it?
Oh yeah, definitely I can.
You don't feel hurt or angry?
No. I prefer people be honest with me.
Elliot Kaloava's hard work and discipline did not go unnoticed by his teachers. This was especially helpful because he decided at a young age that he wanted to become a medical doctor, a profession that had a cultural precedent in his family.
From when I was a child, I was told that my last name, it's Kaloava, and it means life, breath of life and strength. My grandmother was a kahuna, so she was involved in a lot of healing, and she used to use plants a lot. So she used to do that a lot. So I'm assuming that's probably the connection there.
And then you wanted to be a doctor from the time you were a kid.
Yep.
Did you ever see your grandmother treating people?
No, because she died when I was about a year and a half. But my mother would tell me about it. They had a house on Gulick Avenue, and she had a separate room where when she wanted to heal people, she would take them into the room, and she wouldn't let anybody else go into the room. It was just her and the individual.
And did your mother tell you about stories of people getting healed?
Yeah, she did, but all kinds of, unusual things, all kinds of things happened, that kind of thing. And I guess part of the reason my grandmother, from what my mom told me, didn't want anybody else there, especially young kids. She was afraid what effect it would have on them. So I really don't know what kind of, ritual she did. And, I know she used plants. She grew a lot of plants. The plants were the two sacred things in her life were her plants and her Bible, because she was also a deacon at a Hawaiian church, Kamako Ma'aloa. So those were the two sacred things in her life. She was pure Hawaiian, and she spoke Hawaiian fluently. And so my mother and my uncle, because my mother only had one sibling, her older brother, and his children were all older than me, and they all grew up knowing Hawaiian, fluent Hawaiian, because she only would speak English to people who didn't understand Hawaiian, like if a visitor came over. So that's the thing that I kind of feel I wish I had been exposed to. But once she died, the motivation to speak Hawaiian died. So nobody spoke Hawaiian, because this was in the 40s and 50s. So nobody in the family. So my mom, by the time I was old enough to understand, she could understand some Hawaiian words, but she had pretty much couldn't speak it anymore, including my uncle. And
what about other Hawaiian cultural parts of your background?
Because back then when we were being raised, the Hawaiian race was suppressed. It was like they were trying to teach us to be white. Even my wife, she went to Kamehameha from kindergarten to 12th grade, and she said even at Kamehameha, they were training you to be white. So it wasn't until the resurgence in the 70s and also by the time that happened, I was already an adult. So I wasn't really raised around that kind of cultural thing other than just what my family did.
You decided at a young age what you're going to do, and unlike almost all of us, you actually did it. Could you tell us that story?
Well, we used to go to Queen Emma Clinic, and a lot of times we'd wait about 3 hours to see the doctor. And I remember, and I can picture this in my mind, I was probably about 11, between 10 and 12. We were in the waiting room, and it was another one of those long waits. So I looked at my mom and I said, why do we have to always wait? And she says, we just have to. And I said, must be they don't have enough doctors. So I think I'll be a doctor. And it just stuck in my, I didn't even think at that point if it's something I would enjoy. I just said, must be they don't have enough doctors. I never even doubted that I couldn't get into medical school. It was always like, this is what I'm going to do. What do I need to do? What do I need to do to get into college, to get into medical school, to residency? It never was if, it was, what do I need to do?
And while you lived in Pololo housing and were in intermediate school, some adults in your life saw your potential, and they changed your life.
They did. That was when I was in 8th grade, I played Papuana football for the Palolo Vikings. And at the end of the season, the coaches would have an end of the season banquet. And I remember it was at a restaurant in Waikiki. And as I was about to enter the restaurant, our head coach was outside greeting the kids, telling us where to go. And he came up to me and he said, we've submitted your name for a scholarship to Iolani School. What do you think about that? And I just thought, fine with me. Not that I had any desire to do that, but I thought, okay, I'll do that. And then a few months later, the 9th grade counselor at Jared Intermediate called me into his office, and I was only in the 8th grade. So at first I was wondering, why is he calling me in? And he was always a strict person, so I thought, what did I do? I didn't think I did anything to get into trouble. And he called me into his office and he said, we want to submit you for a scholarship to Iolani School. And I said, oh, my football coach already did that. And then that's how Iolani started.
Well, I got to say, it must have been quite the transition from Jarrett to Iolani when you're living in Pololo housing.
It was.
You see parents dropping off their kids at school, and they have these beautiful cars and different clothes every day. And
right.
it must have been kind of mind-boggling.
It was. You know, we had to have a lot of help because for Iolani, I had this scholarship, the Albert H. Stone Memorial Scholarship, and that's the one that pays everything, including the books. And so, but before I could really go, my mom was concerned about how I was going to get lunch because public school lunch was 25 cents. Iolani school lunch was about $1. So what she did was she found out about Queen Liliuokalani Children's Center, and she submitted a request to them, and then they would send us a check every month for $25 to cover my lunch at Iolani. And then so once that was set up, then it was a go. But it was different. One thing, Iolani at the time was all boys. So that was different going from a co-ed public school. But I know some of the kids there would look at me and, because I would hear things that, oh, there's the kid from the housing. But you know, but I had a lot of good friends. My class and I now, we're still close. So I had a lot of good friends, but it was really only a minority. But the thing was, I was raised, and even now I have a little hard time, I was raised speaking very heavy Pidgin. And so it's going there and trying not to speak, you know, because, you could to a degree, but not the degree that I spoke in the housing. And I remember one year we had a teacher from the mainland teaching English class that I was in. And then she wanted to talk about the Pidgin English. And so she wanted to kind of discuss it. And one of my classmates raised his hand and he says, ask Elliot, he's the expert on Pidgin. So those are some of the kind of, you know. But the thing is, my classmates at Iolani was also very supportive of me, very loving.
Elliot Kaloava never strayed from his path of becoming a doctor, and after finishing high school and college, he earned his medical degree at the John A. Burns School of Medicine at the UH. He joined a private practice in Honolulu. In less than 2 years, he left and chose a different setting, a different patient base.
I was in private practice with a year and 8 months with another internist, Dr. Jonathan Cho, who's an oncologist now. But that's around the time I became a Jehovah's Witness. So I wanted more time for my ministry, but I also wanted the kind of population that I grew up with. And the practice we had wasn't that kind of population. And then I saw an ad for Waikiki Health, and they were advertising for a medical director. So this was a chance I could go back basically to my roots and then also have time for my ministry too. I've been at Waikiki Health now 31 years. In fact, 2 days makes 31 years. And I look back and I say, I feel real fortunate because I've got a career that I truly enjoy. I mean, it's not work for me. You know, you hear the cliche that, you know, when you enjoy it, it's not really work. Well, for me, it really is. I go to work and I just enjoy every single day.
So what is the overview of what are your patients like?
Oh, I have a full range. I have patients that are homeless. I have patients that are doctors, lawyers. So I have the full range in between. I have, you know, a full range of different types of diseases as well as HIV.
When you first started treating HIV and it was a new disease, right. I imagine you lost more patients.
Oh, we did, and because we had no treatment back then. In fact, back then we didn't even have the tests that we have now, and so it was really sad. And HIV, of all the different diseases I treat, the HIV patients are the ones I feel a little closer to, and that's because HIV in the early days, now it's not so bad, but in the early days, it was like how leprosy used to be because there was a stigma, people didn't want to be around them, and I used to feel real sorry for them, and then the fact that it was a death sentence. So I used to get real close to those patients, but when treatments came out, you know, it's so much better now.
There's a significant percentage of clients at Waikiki Health Center who don't have insurance.
Right.
How does that work? How do you treat them?
It's real difficult, and so what we have to do, we have to be creative, and that's what, you know, when we have students, especially when they come through. It's interesting because when we have students or residents come through, the first time they're with us, it's funny because they'll say, okay, this patient, I want to order these tests. So I'll look at him and I said, wow, who's going to pay for it? And he says, what do you mean? I said, did you check his insurance status? Because it's in the chart. And he goes, no, I didn't. You need to check. And he'll look and he said, the person's uninsured. So I said, so who's going to pay for that test you want to do? The patient can't afford it. So what we have to do is we have to be less reliant on tests. You know, I'm fortunate when I went through medical school, we didn't have a lot of the tests they have now. We didn't have CAT scans. We didn't have MRIs. So we had to learn a lot on the history, you know, from what the patients tell you, because if you really get good information from the patient, you can probably come up with 85% of the diagnosis. And then the physical exam can add. So we did all these extra maneuvers to try to find out what the person had, you know, like maybe leaning forward while we're listening to his heart. That today you don't have to do so much now because today medicine is so test-oriented. And I said it's real sad because we've got this population of patients that cannot get the things they need, and yet we're surrounded by wealth in this land. So it's real. So, but we never give up. We never turn our back. We never say we can't do it. We still do what we can.
Do you ever judge people?
Oh, not at all. No, especially when I look at, my lifestyle, what I grew up in, There's no point judging anybody because on the surface we might be different, but below the surface we're all the same. One of the things I like to tell students and residents at our clinic, because we see homeless patients, I tell them, I said, if you take a homeless person, put him in one exam room, tell him to undress, that you'll be back in to examine him. You take another person, say a doctor or a lawyer, tell them to undress, you'll come back in and examine them. And this is where people who have a stereotype about the homeless don't really understand. So if you did that and then you go back into either room, sometimes you can't tell who the doctor or who the homeless person is.
Do you think you would be unhappy in a place that had well-heeled patients who could pay their bills with insurance and cash?
Yeah, because I would feel like I'm not doing all that I can do. And the patients that I see, in general, a lot of them are from the same background that I'm from. So that's more so. In fact, 2 homeless patients I saw over the years were kids I grew up with. One of them, I saw his name in the chart, and I went in, and he didn't know who he was going to see, and he had his back towards the door. I went in, I called his name, he turned around, and he didn't recognize me because it was years. When I told him my name, he said, and he was homeless, and I told him my name, he said, I remember as a kid, you always talked about being a doctor, and I wondered if you made it, and I guess you did. And then another one of my patients, I played Little League Baseball with him, and then a couple weeks later, after I saw him, I'm coming into the clinic, I'm walking through the waiting room, he's with another homeless patient, and he stops me and he says, hey, tell my friend here that you and I used to play baseball together. And I said, yeah, we used to play baseball together. I guess his friend couldn't see that his homeless friend grew up with a doctor.
Let's pick up on the Jehovah's Witnesses. Yeah. So when you talk about ministry, are you talking about going door to door?
Yes.
And how do people receive you? Knock, 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 I'm from the Jehovah's Witnesses.
You get a mix. Fortunately for us in Hawaii, many people are very polite. They don't like to be, rude. So we go into, we start talking, and then sometimes, a lot of times they'll just say, oh, I'm not interested. And then we just leave. Other times they'll listen, and then we share a few things. And occasionally we do have some people that are just rude. And they just say, oh, no, don't come here or get out of here. Or they slam the door,
And why is it worth it to you to keep doing that?
The Bible has such an important message, because it doesn't matter what religion a person is. There's Bible principles that can really benefit them. In fact, one man that I used to visit regularly, he actually was an atheist. But he used to love me coming by because he said he loved the principles in the Bible. When I talk to people at the door, I know most of them have no desire to be a Jehovah's Witness. But if they can at least apply some of the things in the Bible, they would have a better life. And that's why I do it. Again, it's concern for people. It's like when I see all the suffering and I see how people are, I think, you know what? If you could follow some of these principles in the Bible, you would have a happier life. It's not going to solve all their problems. Obviously, if they've got some chronic medical illness, but at least it'll help them cope with it better. How to have a healthier lifestyle, because the Bible condemns things such as drunkenness, drug abuse. There's principles about always trying to have a smile, always trying to laugh, and it does help the body. We do know medicine has shown that when people are more, tend to laugh more, that it does help the person and all that. So those kind of different things that can help a person. And then also it gives them a hope for the future. It's amazing how strong hope is. So whether it's in a spiritual nature or in a medical, hope is a powerful force. And that's one of the things when I go door to door, I like to let people know that, you can have a better life now as well as a hope for the future.
Mahalo to Dr. Elliot Kaloava of Honolulu for sharing your inspirational life story with us. And thank you for joining us. For PBS Hawaii and Long Story Short, I'm Leslie Wilcox. Aloha a hui ho.